Good morning. My name is Anjana Anthony. Today we will discuss about the wound healing. Firstly, I introduce what is wound. Everybody is know about it. Then also, it's a replacement of destroyed tissue by living tissue. That's wound healing. Wound healing is the replacement of destroyed tissue by living tissue. And healing occurs through tissue generation and scar formation. Everybody is know about wound healing. Then also some of the stages and something is there in that to study. The next, then we will discuss about the healing process. What is the healing process? It's have mainly three phases for healing. I will explain it now. During healing, it's a complex cellular and molecular events occurs while wound healing. So it is the process of restore the tissue, continuity, function, and the strength. The wound healing is very important in our life. If the wound healing happens, first is homeostasis and inflammatory phase. First one is the inflammatory phase, then proliferative phase. The third thing is remolding phase. In that inflammatory phase, the homeostasis and inflammation phase is occur. Then second, granulation, contraction, and epithelialization will happen. The third phase, in that third phase, the collagen maturation and scar strengthening will occur. We will detailedly study in the next part. First thing is inflammatory phase. In that inflammatory phase, the wound occur, the first thing is hemostasis will start, which means when the drop of blood is come out, the vasoconstriction will occur and stop the bleeding. I will explain inflammatory by the slide which I shown in that. Begins immediately after tissue injury and lasts for several days. It takes several days to heal. Not only heal, the inflammatory phase will take several days. Clear? Then the hemostasis occurs through vasoconstriction, means blood vessel construction, and platelet aggregation and clot formation. This is mainly happens in the inflammatory phase. Then inflammatory cells remove the bacteria. Debris means excess amount of dead tissues and damaged tissues. Clear? Then neutrophils and macrophages plays major role in the early inflammatory responses. I think what are happening in the inflammatory phase, I already explained. Okay. First thing is after the injury, the last several days happen the inflammatory phase. Then hemostasis. Firstly, hemostasis will occur. In that period, vasoconstriction means blood vessel construction and platelet aggregation, clot formation will happen. Then the inflammatory cells means WBC and all they will remove the bacteria, debris, and damaged tissues. Clear? Next is proliferative phase. In that proliferative phase, it will take within few days to several weeks. What all are the things happens in the proliferative phase, which is shown in the slide? First thing is fibroblasts produce collagen and extracellular matrix to heal the wound easily. Then granulation tissue develops and new blood vessels forms. If a cut happened, the blood vessels already get injured. Then it's need to produce or develop new blood vessels. Next thing is epithelial cells migrate across the wound surface. There are some epithelial cells migrate to where the wound is happened to the the epithelial cells migration will happen. Next thing is wound contraction, reduce the size of the wound. Wound contraction will occur to reduce the wound size. I think cleared all these two phases. Next, we move on to the third phase, remodeling phase, which take few months. If some of the scar or something is there, if the complete healing sometimes is possible or not. Some of the scar remains for few months, few years. That's the remodeling phase. It begins after which phase? Proliferative phase. Then collagen fibers are recognized and become strength. In that proliferative phase, the collagen fibers are developed, starts to develop only. Then it's the remodeling phase, it becomes stronger. Then the third point is excess blood vessels and cellular components decrease. Which means that in that proliferative phase, the wound will become swollen and somewhat irritation will be there. So in this phase, the excess blood vessels and cellular components will decrease. Next thing is scar that gradually become flatter, paler, and more mature. Next is if the tissue is healed also, there is some time to take it to the original tissue strength completely. It takes more time. Okay, some of the factors. Next thing is some of the factors affecting wound healing. First thing is age and nutrition status. If the person is too old age and the nutritional status is poor, the wound become late to heal. Next is infection and poor blood supply. The infection cause some of the another cross infection or something else which make the wound is difficult to heal. Next is diabetes and other chronic illness and smoking certain medications, excessive tension, pressure and repeated traumas, poor wound care and inadequate oxygenations are affecting the wound healing. That's the factors affecting wound healing. Next is nursing management. How can I or you manage if the person is getting wound? Assess the wound size, color, drainage, and signs of infection. If the person getting, if a person getting wound, as a nurse, I will check the size, color, drainage, and any kinds of infection. Next, then I will do some of the aseptic techniques. We all are nurses, so we know the aseptic techniques during wound care. Next, we provide wound dressing as prescribed by the doctor. The doctor prescribed some of the ointments while wound dressing. We will do the according to the prescription. We will provide wound dressing. Next, sorry. Encourage adequate nutrition, protein, and fluid intake when appropriate. Then we will check the blood glucose level of the patient. Okay, the patient have diabetes. Next, educate the patient about wound care and prevention of further injury. We will inform the patient to avoid wetting of the wound and any don't touch any contaminated areas and keep the wound dressing clean and dry. Okay. Next, I will tell you some of the summary facts which is we already discussed about. The wound healing is the coordination of process, mainly three phases: inflammatory, proliferative, and remolding. Next, the three phases and what is the thing happened in the both in the three phases, and what all are the nursing management and factors affecting the wound healing. I think the topic is clear for you. And if you have any doubts, you can ask.